You don't necessarily have to sign up for Medicare if you have VA coverage, but you should. And in this video, I'll not only explain why, but show you ways that you can get a bunch of extra coverage at no cost to you, and perhaps even a rebate on your Part B premiums. People who have served in the military qualify for VA benefits at some level. You will need to apply for veterans benefits to determine what level of benefits that you are entitled to receive. There are different benefits classes based on your health and your military service history. I should also mention that VA benefits are different from TRICARE benefits, which are for people who retired from the military. TRICARE for Life benefits wrap around Medicare, so folks with TFL must enroll in Medicare Parts A and B. Your VA benefits will give you access to care at VA hospitals and from doctors at VA clinics. However, we've all seen the media coverage about wait times for care at the VA, and of course this varies by facility. During the COVID-19 pandemic, data from the VA showed a dramatic increase in appointments taking more than 30 days to schedule. So if you sign up for only VA coverage and no Medicare coverage, you could find yourself frustrated at your level of access to timely care. Enrolling in Medicare as a backup is a great solution. Medicare Part B coverage does have a monthly premium of $170.10 in 2022, but that premium gives you access to over 1 million Medicare civilian providers nationwide. If the wait time at your VA clinic is unacceptable, you can make an appointment with a local doctor, and Part B will pay 80% of the cost of that visit after a small annual Part B deductible. I recommend enrolling in Medicare Parts A and B when you turn 65 or whenever you retire and lose healthcare coverage from your employer. The reason is that your VA coverage may not cost you anything, but it is also not considered creditable coverage for Medicare. So if you don't enroll in Medicare when you first become eligible, and later you decide to sign up to gain some of the flexibility and freedom of access to providers that I'm talking about here, you could be subject to a late penalty of 10% for every 12 months that you could have been signed up for Part B, but you were not. You also have to wait for the next general enrollment period to sign up late for Part B, and that only rolls around once a year from January 1st to March 31st. Depending on when you discover that you really wish you had Part B, it could be many months that you have to wait to get into that coverage. It's equally important, in my opinion, for veterans to sign up for Part D, even if you just pick up the cheapest Part D plan in your state. You can find them starting at around $7 a month in most states. The VA has its own drug formulary, a list of medications that it will cover. We have found that many of the more expensive brand name drugs aren't always on that VA formulary. If you use Medicare Part B to see a doctor in your community, you also cannot fill a prescription that he gives you at the VA clinic. So having Part D will give you some coverage for those medications. My dad is a Vietnam-era veteran, and we signed him up for Medicare Parts B and D, as well as a high-deductible Medigap plan to limit his potential annual healthcare spending. Sure enough, he found the VA clinics to be a hassle and quickly switched over to using his Medicare Part B. The Medicare doctor prescribed him 2 brand name medications that would have cost him around $740 a month combined out of pocket, but on the Part D plan we enrolled him into, he was able to get those for a $47 copay. We've also had many veteran clients who have opted for low premium Medicare Advantage plans and seem to be quite happy with these. The bottom line, enrolling in both the VA and Medicare will give you flexibility in your options for where and when you receive healthcare services. You will have access to physicians in your local community through your Medicare Part B. Now, let's talk about another way that you can get extra benefits at no cost to you. Our team does a great job of finding zero premium Medicare Advantage plans for our veteran clients. When you enroll in Medicare Parts A and B, you are then eligible to enroll into a Medicare Advantage plan in your area that will provide you with not only hospital and outpatient services, but also with Medicare Part D coverage as well. Many Medicare Advantage plans also have bells and whistles that are attractive to veterans, such as dental, vision, and hearing benefits, in-home support benefits, and even gym memberships. In most urban areas, we can find Medicare Advantage plans that have zero premiums, which means you don't have to pay anything for the plan itself other than what you are already paying for your Medicare Part B. There are even Medicare Advantage plans with Part B buyback provisions in some states. This means that the plan actually pays you to enroll in their coverage by means of reducing your monthly Part B premiums. If you enroll in a plan with a $50 buyback, the plan will credit $50 a month back to you on your Social Security check for that 1 year at least. Some Part B buyback plans do not include Part D, so you'll want to work with an agent here at Boomer Benefits who can help you evaluate which plans you are eligible for in your area that will offer you the most benefits. And if there is anything that you don't like about your Medicare Advantage plan, then you still have your VA benefits to fall back on, which I believe makes Medicare Advantage plans a good option for our loved and respected military veterans. To learn more about the free help that we offer veterans with their Medicare decisions here at Boomer Benefits, check out this video next.